Hi, so my name is Jessica Williams. I am going to do a brief educational video on the care, maintenance, and removal of peripheral arterial lines in the pediatric PACU population. We're going to concentrate on the radial A line, which is what will be seen in our population. They're typically left in place by anesthesia for lab sampling and invasive blood pressure monitoring during their stay in the PACU. And we'll also address the removal of the arterial A line prior to their discharge to the inpatient unit. So this is what you're expecting to see in a patient that's coming out of the operating room with a arterial line in place into the pediatric PACU. You're going to see the catheter, most likely in the radial artery of the wrist. You're going to see a T connector, and then you're going to see the rest of the tubing, which is part of your transducer setup. Okay, this is your sampling port. That's the first port you'll see. This is the actual transducer. This particular port is capped off, but we're going to add a normal saline syringe to that. The cord is going to be hooked up to your monitor. And you have your transducer bag, which is a 500 cc bag of normal saline, pumped up on the pressure bag to 250 millimeters of mercury, which is a green mark on the bag. So when the patient comes out of the operating room with anesthesia, the end of the transducer cord is going to be on the bed. So the first thing you're going to do is obtain the correct monitoring cord from the supply room, which would be the cord that has the red end, and then the opposite is gray with an arrow, and that's going to actually attach directly to the patient cord. Okay, so right after your patient arrives, you're going to take the cord, which you've obtained from the supply room. You're going to attach the red end directly into the red end on the monitor. And then you're going to take the monitoring cord that you've already plugged into the monitor, the arrow side up, and you're going to attach it to the patient transducer line like so until it clicks. As I stated before, when the patient comes out from the operating room, they're going to be attached already to the transducer. But at this point, you're going to see a cap over this second port from the patient. We're going to take a 10 cc syringe, empty syringe. We're going to remove the cap, place the 10 cc syringe onto the port. You're going to see an off. You're going to turn it off to the patient. Press these two buttons up here, which will give you saline flush from the bag. Fill it to 10 cc's. Turn the port back to off, and then you'll be ready to zero. An important thing to remember prior to zeroing your transducer is ensuring that the transducer is at the right position prior to zeroing on the monitor. The correct position for a transducer is at the level of the right atrium of the heart, which is also the mid-axillary line. So this is where you're going to want your transducer prior to zeroing. When the patient arrives from the operating room, the transducer bag will likely be laying in the bed with the patient. So what you're going to want to do upon arrival is take the transducer bag off the bed and hang it up on a IV pole. Upon arrival to the PACU, in order to ensure accurate blood pressures through your arterial line, you're going to want to zero your transducer as soon as possible. That involves proper placement, which is mid-axillary line, right atrium. You're going to take the port, turn it off to the patient, and remove the 10 cc syringe. Then go up to your monitor. You have your arterial wave reading here. You're going to hit zero all. You're going to see zeroing and then zeroed. When you see zeroed on the monitor, you know that the arterial line's been zeroed. Immediately following zeroing of your arterial line, you're going to want to obtain a cuff blood pressure on the opposite side of the arterial line. Additional assessment upon arrival in the PACU would be just to simply assess the arterial line site, ensuring there's no excessive bleeding under the dressing and that all the connectors, both from the arterial line into the T connector and the T connector into the transducer, are all tight. Okay, so Again, we're noting that the transducer is attached to a 500 cc bag of normal saline, and the measuring device shows that you're pumped up to 250 millimeters of mercury, which is giving the patient 3 cc's an hour of normal saline continuously, which you can record on your flow sheet. You always have to have something infusing through an arterial line to keep the line patent. So that's why you always has to have the pressure bag pumped up to 250. Okay, so the next thing we're going to address is the other function of keeping an A-line in a pediatric PACU patient, and that would be for ease of lab monitoring. What you're going to need to do any lab drawing from your arterial line is 2 3cc syringes and some non-sterile 2x2 gauzes. Okay, so prior to actually drawing your labs, you're going to open up your 2 3c syringes and place your non-sterile gauze underneath your sampling port, which is the first port closest to the patient. This is to prepare for your waste so that you ensure lab accuracy. You're then going to go up to your 10 cc syringe. You're going to turn it off to the transducer. You're going to pull back on the 10 cc syringe, watching at the patient connection for blood to pull back past the sampling port. Once we pull the blood past the sampling port, we're going to go back up to the 10 cc syringe and turn the stopcock back off to the 10 cc syringe. So once you have the blood drawn past the sampling port, you're then going to take the first of your 3 cc syringes, remove your cap off your sampling port, which is the closest to the patient. You're then going to place your 3 cc syringe on your sampling port. You're going to take the stopcock and turn it off to the transducer, pull back on your sampling syringe for your waste between 2 and 3 cc's. Then you're going to take the stopcock, turn it at a 45-degree angle back toward the patient, remove your waste, take your second 3 cc syringe, place it back on the sampling port. Now this is going to be your lab. You're going to turn the stopcock back off to the transducer. You're going to draw back for the sample, whatever you need for your sample. Then you're going to take the stopcock, turn it back off to a 45-degree angle, and then remove your blood for your labs. Okay, so now you've drawn your lab, and now you're going to need to flush your blood back towards your patient to clear your line. You can do that in one of 2 ways. You can either turn the stopcock off to your sampling port, and then you can use your 2 flush buttons up here, press those until the line clears, and you can watch at the hub of the catheter to see when your saline clears the line. Then you're going to turn the stopcock off towards your patient just to clear your sampling port. And again, you can use the flush for that and your gauze on the bed. All right. And then you're going to turn it, the stopcock back up toward your sampling port and replace your cap. If you're concerned at all about fluid restrictions in your patient, another way to clear your line is instead of using the buttons to just flush through your lines, you can actually use the syringe and you can turn it off toward the transducer and you can clear your line with your 10 cc syringe so that you are giving the patient a little less volume. Another important thing to remember is to try to keep the arm in a somewhat neutral position if the patient tolerates it so that you can ensure an accurate wave on the monitor. If you're finding that the arterial line does not draw back and will not flush, then you should speak with anesthesia before doing anything else with your arterial line. One additional very important safety thing to remember with patients that come out of the OR with an arterial line is that the arterial line should always come out already attached to a transducer. They should not be capped. If they come out capped just during bedside report, please make sure anesthesia attaches a transducer for you. And in addition, the reasoning behind this is that if the patient's not hooked to a transducer and you don't have a blood pressure wave on the screen, then you have no way of knowing if it's attached. And if it isn't attached, the patient can, because it's an arterial line, blood will flow out of the arterial line and essentially their patient can exsanguinate without you knowing it. And the last thing we're going to talk about with arterial lines is the removal, because unless the patient ends up going to the ICU, you'll always be removing your arterial line prior to sending them to the floor. So you're going to make sure you have some gauze on you available. And then you're gonna remove the dressing off your patient's arm while holding the catheter. Once you get the dressing off, you're gonna get your gauze ready. You're gonna place your gauze over the arterial line site, remove the catheter, and then you're gonna hold pressure on the radial artery for 10 minutes prior to starting to check it for the bleeding. So now we're gonna take a brief look at the new system referred to as the Safe Set, which we may see in some of our patients coming out of the OR into the PACU postoperatively. We're going to go through just two quick skills. One would be drawing blood from this new system and also zeroing this new Safe Set system. Okay, so in terms of this new potential Safe Set system that we may or may not see in some of our patients, there's similarities and differences to this other system. The similarities start with the 500cc normal saline bag, the measurement manometer where you're going to be pumped up to the green marking, which is 250 millimeters of mercury, down to the transducer system, which is exactly the same. And then the differences start with the Safe Set waist syringe, which looks like it's a 10cc syringe, attached to the tubing, which attaches to the patient, and then there'll be two potential sampling ports, but we're going to always sample with the port closest to the patient, and then each of the sampling ports will also have needleless ports to draw the blood from. Now we're going to go through the process of obtaining a blood sample from the new SafeSet system. So the first thing we're going to do is turn the stopcock from the sampling port closest to the patient off to the sampling port. Okay, then we're gonna move over to the 10cc waist syringe and we're going to pull back. Can sometimes be difficult because it's got to be squeezed tightly. We're gonna pull back until we get blood into the sampling port. All right, so once you can see blood into the sampling syringe, then you can stop. Following pulling your waist into your waist syringe, you're going to take the stopcock, which has been pointing towards your waist syringe, and turn it this way to keep your waist in your syringe. Then you're going to come down to your sampling port, which is the one that's closest to your patient. You're going to take a Chlorapep and you're going to clean your sampling port. Then you're going to take a 3cc syringe and you're going to draw your sample from your patient right into the 3cc syringe. No need to get a waist because we've already gotten a waist in your waist syringe. So after you get your sample, you're going to turn the stopcock up to the sampling port. So off is pointing towards your syringe. You're then going to remove your sample and then you're going to move your stopcock back to the position where it's opposite the sampling port. So to return your waist to your patient, you're going to first turn the stopcock to the syringe. Then you're going to use this device up here and you're going to return your blood and saline back to your patient. When you get to the end, you need to make sure that the two devices at the end clip in and lock so that the syringe can't move anymore. And then to fully clean your line, clear your line to the patient, you're gonna come up here to the transducer and you're gonna push on these two white buttons, and then that's gonna subsequently clear all the blood from your line. So once the line is clear to your patient, then you can stop. And then the last step is to take a Chlorapep and clean the sampling port, and then turn your stopcock off to the sampling port. So with the SafeSet system, as well as the old system, you're gonna still have the same connecting piece that's gonna attach to your monitor. Nothing will change. And then we also need to remember the position of the transducer needs to be at the level of the heart at the mid-axillary line. One thing we also need to just mention in terms of zeroing the arterial line when the patient arrives to the PACU. With the old system, you would remove the cap after turning the stopcock to the patient. You're still going to turn the stopcock to the patient, but then you're not going to remove the cap because they're not removable. We had talked about this transducer needs to be at the level of the heart, mid-axillary line. In some cases, the transducer can come out on one of these mounting plates. The only change in that would be that your stretcher needs to be pulled up so that the monitor transducer part is still at the mid-axillary line at the level of the heart. That can be stretcher coming up and or mounting plate coming down so that you end up exactly where you should be.